Thank you, Willie.
Welcome, Alex.
Thank you, Willie. Thanks for having us here. Thanks for inviting us. Thanks for putting Dan Rothman up. So, am I standing in the right place? So thanks everybody for coming out tonight as well. So what MedStartr does is crowd accelerated investing for early stage health and medical companies. And one of the things that's been happening in healthcare and venture capital in general is that even though that the amount of investing in total dollars and total deals is going up, the number of deals is actually going down, meaning you're getting larger deals, but this is creating a very early stage sort of crunch where a lot of companies can't really get that funding early on, and it's understandable because it's very hard to pick the right companies, right? So how do you know which company is going to start and accelerate as rapidly as Miami or Triage or any of these other companies have done that we've seen in Romada? Traditionally, Techstars and Y Combinator, all of the 500 startups, they haven't really done a lot of healthcare companies, or they haven't succeeded in healthcare. And more companies are moving towards like a corporate VC model, or there might be a university, or Cedars-Sinai, for example, has a very interesting model. But it's very hard to pick winners in healthcare. In New York, we actually used to have 8 different healthcare accelerators, and now I think there's like 1 left because they really just, they weren't picking winners. Even getting 1 out of 10 was considered good. So this is some data from KPMG. Basically, they're saying that if you can find a niche and go very early stage, and you have an edge, a way to pick the companies essentially, then you should be able to do very well. And we've been finding a lot of interest in what we're doing. So let me step back a little bit and say what we're actually doing. We're right now going around raising for our second close for the MedStartr Venture Fund. We're first-time fund managers, so we figure it's going to take a year to get up to the $100 million level, but we'd like to get up to 8 digits or so this time around. So we're looking for folks to invest in the fund. It's typical 2/20 over 10 years, and we do very early stage and acceleration investing as well. So one of the things we noticed in the things that we do, and we'll go into that, is that we're very good at predicting which companies are going to be successful. We have what we call the MedStartr Venture model, and if we looked in a retrospective way at the first 76 companies that did well based upon our metrics, and over 45% of them were successful, which if you think about it, as a typical accelerator, you're happy if you get 1 out of 10 that does well. These companies, even though they did well on the platform, raising like $1.2 million, they'd raised over $400 million off the platform. So they had follow-on funding, $312 for every dollar they raised on our crowdfunding platform. So leading to over 70 transactions. A lot of these companies you probably have heard of. I'm sort of jumping into some of the detail, but we run these contests, and so these are some of the contests we ran. And so you can see our friend Dan Rothman from Miami here. You can see where he won. Where is he? There he is. So he won the Medmo. Medmo is short for MedStartr Momentum Challenge in 2016. And then we invested, and then they got into a number of accelerators. They got a number of pilots and things like that. So, that's just one of many examples. There's Misfit Wearables. Does anybody know Medable? Anybody know Michelle Longmire? Medable first won a contest on MedStartr back in 2013, I believe, 2014. But lots of other great companies got their start with us. So how do we actually do this? Well, before I get into that, a typical venture fund has to do 4 things really well, right? They have to find great companies. They have to select the best ones. They have to help them grow and help them exit. What we've developed is a way that actually works much better than traditional venture funds. To some extent, you could say that 20 to 30 times better than traditional venture funds. So we do this with a series of 5 different types of things. So we do events like this around the country and in New York, and conferences. We have a crowdfunding platform. It's the #1 crowdfunding platform in healthcare. We run challenges and contests for corporate sponsors and cities and associations. And we have a way of measuring the success of these companies, which we call crowd metrics, which measure lots of different things. We'll go into each of these things a little bit. And then we do due diligence on the companies, and we put them into the program where we start to work with the companies. We take them around the country with us on tour, and we accelerate companies in lots of different ways. So these 5 elements together make for a really great way of getting to know the companies and then figuring out which companies are the best and doing the metrics on the companies to see which ones are going to be successful. So, but this all started with a little meetup group, not unlike this, in New York. It's called Health 2.0 New York. And our first event, we had 120 people come. And one of the things we started to see was that when people got together, lots of amazing things happened for those companies. It was actually the first of over 100 such groups around the world that a network that we helped develop. Online, we run the leading crowdfunding site called MedStartr.com. In person, we're running 20 or 30 events around the country a year. This is our 8th city this year and our 10th event, for example. We partner with big companies, and when we do stuff, so I don't know if you guys are watching on Twitter right now, but there's been probably 250,000 impressions for this event because we've been tweeting out things and people have been retweeting it and things like that. So things that we do go viral very quickly. So in summary, we do events, conferences, crowdfunding, crowd challenges, innovation programs, acceleration programs, and now we started investing last year. So this is an example of our, what we call the world tour. So, it used to just be the United States, but we're expanding into Europe, probably Canada this year. So I guess technically we can call it world, although, it's mostly the US. So we've already this year done Miami, New Orleans. We're doing LA tomorrow morning. We're here today. We did a little thing at HIMSS, and we go around to do these events. We do pitch contests in most of these cases. The goal is to find as many great companies as we can as we go around the country, because we know that not every great company is in New York, although there are a lot of great companies. Well, one of the things we do is we engage our crowds, right? We get to know all you guys. So like the forms in front of you at each pitch contest, we'll do something like this, and we'll collect the information, and it's not just that people like them, but who the people are. So the fact that you've invested in 3 companies, the fact that you're starting a company, that you're a physician, that you used to run innovation at Kaiser, or whatever it is, you guys know a lot more about these companies than the average person off the street. So anyway, so our crowd is made up of about 17% providers like yourself, and about almost 25% patients, but then there's also patient activists. Do you guys know what patient activists are? So did you guys see the back of this jacket? So the back of this jacket was painted by a woman named Regina Holiday, who's one of the most famous patient advocates out there. Is this working? Yeah, I think it's dying.
Project.
I guess I will have to speak a little louder. So Regina Holiday is one of the leading patient advocates, and she paints these jackets. But the thing about it, that once a patient advocate gets involved in your project, it makes a pretty big difference. So for example, in Daniel's project, thank you. In Daniel's project, when Tiffany Peterson got involved and she started spreading the word, she then spread it to her 40,000 followers. So even though that little slice is a very tiny slice of patient activists, they actually are extremely helpful in making things happen. So this crowd gets involved, and they're not just engaged people, they're engaged stakeholders in the healthcare system. So they might be hospital leaders or pharmaceutical leaders. And so when these people get involved in a project and they click on and they say, yes, we're interested in these ideas, it really matters. They share things, they get involved. And then the last group that I want to talk about a little bit are partners. So when we run acceleration programs, Amazon, PricewaterhouseCoopers, software companies, companies like Bear, they get involved with our companies, invest in them, and want to talk to them, and we'll make conversation with them. So all of this is about engaging crowds of people. Our main method of engaging large groups online is a website called MedStartr. So I can actually take you through, this is actually Dan's project. We can take you to his actual project. That before this project, I don't think nearly this much stuff was going on for Miami. So taking them out of, let's just say, the doldrums, and putting them front and center in the world. So in a matter of a couple of weeks, Dan and his team had managed to get over 100 likes. Oh, that's interesting. We good? Ooh, I get double lavalier.
Yeah.
Wow, lucky me. I have to make sure I don't cross the streams.
Yeah.
Anyway, so they got over 166 people to get behind their idea. And there's all these crowd metrics on the site that you can see very visibly. This is MedStartr.com. This is an excellent project on MedStartr.com. And we always like to point to it as an example because they were one of the first ones to use the new and improved version of the platform so beautifully. Anyway, so during the course of a 5-week campaign, they got 166 people behind them, 2 partners, 3 pilots, and I believe $119,000 in funding just in a couple of weeks. Now, this company had been around for 5 years. And then Dan joined them, and it really just, I think, made it so that they had all the elements they needed. They were at the precipice of greatness. MedStartr helped identify that, and then we invested in Miami. This is an example of our selection methodology where the crowd metrics help us sort the Miamis of the world from everybody else. So I think I can go back to the deck now. So we designed MedStartr.com just for this purpose, and behind the scenes, there's lots of mechanics that make it all work. I mean, at the end of the day, crowdfunding is really a market insight tool, right? When you get 1 million people to a website to go look at 100 projects, you're going to know new things about those projects that nobody else knows, right? Especially if you credential thousands of them and you figure out exactly where they are in the healthcare system and how important their clicks are, both in negative and positive senses. So for example, if you're a medical student and you say that you want to partner with a project, you actually lose points because you obviously told that medical student to go and click that button. If we see a pattern of this type of behavior, we track that. So anyway, so we get lots of data. At the end of the day, the companies that do well on the platform are much more likely to be successful than those that don't. Another thing we do is called Crowd Challenge. So originally, GE put us up to this. So basically, to use crowdfunding as a method to figure out which companies are the most likely to be successful in any particular area. So the first one we did was actually for HHS and the NCI. And so the company Medable won that. And they won it, it was called the Crowds Care for Cancer Challenge. And they won it by basically being well designed and all of the stakeholders saying, yes, we like this. The way those work essentially is that you lay down the problem, we run a campaign, it gets massive attention, hundreds of companies apply, millions of people hear about it, thousands of people come to the site and they click on things, and then we put the last teams on a stage not unlike this, usually bigger. Sometimes at big conferences, sometimes at our own conferences. And the top 5 teams, somebody wins that contest. And it's judged like these, with these forms in front of you and with expert judges by stakeholders who might be the ones to adopt these new ideas. So the partners who get behind these challenges, as Uli was saying, are many. Some of our best ones have been run for the American Heart Association or the American Medical Association. Takeda Pharmaceuticals sponsored a big one. And we do a couple of these every year as a crowd challenge. We now sponsor our own because at the end of the day, we want to be able to see all the data and be able to pick the teams. We just finished 3 for the city of New Orleans, Blue Cross Blue Shield and Ochsner Health and Tulane Medical System, which is part of Columbia HCA. And so it was great to work with all those guys to find the best new blockchain idea, like we were talking about, or the best new idea for diabetes. And so this is also where we get our data to analyze for our next investments. So it's one of my favorite challenges. We ran it for the American Medical Association. This is a little case study about that. So basically we had 396 teams apply in 5 weeks. 117 of them went live. There were 84 million impressions on Twitter. That basically puts us in the same category with a Kardashian, which is crazy for healthcare geeks, right? It's true. We've actually got 10 million in an hour a couple of weeks ago. So this is actually impressive, but it was over 5 weeks. We could probably do that in a day if we had to. But here's the interesting thing. Over 17,000 times, almost 6,000 people, of which I believe 41% were physicians, clicked on these projects, and they said what they wanted to work with, right? And 3,100 times people expressed interest in piloting and partnering. Now granted, there were issues with this, and that's why we created what we call the honesty metrics. So I'm not really sure that all of those 3,100 times are real partnerships, but it's still a pretty amazing number. But at the end of the day, this site became the #1 site for physician innovation. And the winner, has anybody heard of Triage? Anyone? Had you heard of it before this? Probably not, because they only had 1 pilot in 1 hospital. They were what I call a zombie startup, right? And they had been around for 4 years, been through 2 accelerators, just showing the fact that just because you get in an accelerator doesn't mean that you're going to be successful. And then they go into this crowd challenge for the AMA, and suddenly within 90 days, they have 11 more closed hospitals. Anybody ever try to sell into a hospital? What do you think? It's fun, right? Even after you sell them once, you still haven't sold them. So they managed to close 11 hospitals. And it wasn't necessarily the product had gotten that different or that changed, is that the team was right, okay? Just like you're looking for that great salesperson, when they come in and you find the right person and they get involved and they can go and grow, they're going to make the eyeballs of the people who you're talking to light up, right? Dan did it with Miami. And we see this all the time, that it's just a matter of having the right chemistry. And then when you have everything in the right place, that's what we find. We find companies on the precipice, ready to grow like mad. This company is now in 42 hospitals, probably more. This slide's a couple of days old. But they're in thousands of ambulances, and they're growing like gangbusters.
We had a good conversation with Ascension. They're the same thing, plug and play down the street.
Exactly. So all we do is we find them at the right point, and then we help them get where they want to go faster. Part of our secret sauce is our crowd metrics. So figuring out who's working hard, who's being honest, who's got the best product market fit, who's doing everything that they're supposed to be doing and not doing the things they're not supposed to be doing, who's getting really interested feedback. So we've been at these events like this, and people have written in, I'm going to invest in this company, okay? That's important. That's just at an event. On the line, there's a button for that, and people click that button all the time. So we get to see all this information. So imagine if you could take 40,000 people looking at a project and you could see exactly what they're doing, their thoughts based upon their actions or their inactions, right? So what they're mouse overing, what they're watching the videos of, all of these different things we track and we put into our metric system. Another key element are the people, right? So if I send a project to Richard Park, like I did yesterday, and Richard says, I'm interested. I'm sorry, Richard Park is the guy who founded CityMD. Went from 0 to 72 urgent care centers in what, 7 years? 6, sorry. But anyway, but super nice guy. And so when I have a new telemedicine urgent care play that needs an advisor, I send it to him. And he says, okay, we'll talk to them, just because you asked, right? But also the system does this automatically. Mentors in the system will be notified, hey, there's a new urgent care project that just came in. Would you like to see it? So these are just some of the mentors. And a lot of these people came up through the system or are currently working on it. So take Jacob Rader. Anybody know Jacob? Jacob R on Twitter. So he used to be at ONC. Now he runs a PPS, which is Provider Care Network in upstate New York. We ran a challenge for him to help reduce the cost of Medicaid for about 1/25 of New Yorkers. So whenever we send him a project, he's excited to see it. So these are the experts that we ask their opinions of automatically online, and there's literally thousands of them. So imagine if you had all of those people involved in checking out your ideas. I don't think that Sherrod and me and Bruce, my partners in this, and our investment review committee, I don't think that we're the best pickers of companies. But I do think a large crowd of people is very good at picking companies. But we don't stop there. After we do that, after we find the winners in these contests, we then do a more traditional due diligence process. And Sherrod actually runs that, so he can talk to you more about it. But essentially, we go through all of their due diligence documents, and we narrow it down from 30 or so companies down to 2. Although, honestly, those numbers change based upon how many people apply and how many go into our due diligence process. But the hard thing as a VC is sorting out the first 1,000 from the first 50. Well, we've got a system for that. And then we can really focus on those last 50. When we get involved in a company, we accelerate them over the course of 2 or 3 years. We initially give them a little bit of money and a lot of services from our partners, and then as they get larger, we do more in exchange. So this is typical accelerator model. So this isn't really that special. Really, the selection process is special, and the mentor network. So how's it going so far? Initially, when we did that, when I put up that first slide, with the proof of concept, these are companies coming from that proof of concept period. So amazing things happen to these companies, right? So Misfit Wearables, anybody heard of it? Anybody buy one? No? Yes? So Sunny Vu, we put him on stage in San Francisco in 2012. 30 months later, he sells to Fossil for $260 million. So he went from pre-revenue to a crowdfunding campaign that we helped him with, and on our stage to off the chart sales. I don't even know how you count that, but definitely one of our acquisition-based unicorns. And then there's ones that just run on revenue. So IHT Spirit, also a wearable, this one for gym class, they won a contest we ran in 2014. And then she went on to get adopted, partnered with Adidas. Adidas is putting her product on every kid in America. So then we started actually investing in companies last year. And so Miami, you've heard a lot about them, but essentially they've grown at least 10x since we got involved with them. Karen Ware went from 0 revenue to over 500K just on PICC line covers. Who even knew there was a market for that? Now their second product is hospital gowns, so a much bigger opportunity. And they were just written up in the New York Times for their great design. Triage, as we talked about before, has gone from one hospital to over 42, and is really just killing it. So that's 3 for 3. I'm not leaving anybody out. We only invested in 3 companies starting last August. All of them have grown enormously, and now we would like to scale that up and do even more. Honestly, we want to do about 20 companies a year for about 5 years, and then do follow-on deals. So if we put $100 million to work, this is what it looks like. And so our initial check sizes, so we do this in 3 tiers. So our initial check sizes are not that big, less than $100,000. Our second ones should be up to $1 million or so. And our third ones should be up to $3 million if we do this right. So that's what we're going, and that's what we like to be doing. You can compare us to other accelerators or crowdfunding platforms. You guys have heard of Startup Health or AngelMD or Angel Co., also known as AngelList. The fact is that the traditional portals don't always do healthcare. Healthcare is definitely different. If you noticed, our crowdfunding portal is really designed for healthcare. And also, we've got that crowd. Over 50,000 people are engaged in our platform and our projects that get involved with these ideas. A lot of portals like AngelMD just run for the finish line, right? They just go for the equity crowdfunding. But to us, there's this thing called a generative cycle, where lots of little things lead to bigger things. And when a patient and a doctor and a hospital leader, when they get behind an idea, it helps us as investors see which companies are most likely to make it in the marketplace. And when you get 100 patients, like Daniel got, when you get people with lupus saying, yes, I want to try this, when you get doctors who are treating people with lupus saying, yes, we'd like to try this out for our patients, and hospitals saying, we want to try this fitness device for 23 of our centers, these are the things that really matter for figuring out which companies are going to be successful. So I think a company that only looks to do equity crowdfunding only with investors is kind of missing the point. They're not doing the crowd validation step. They're not saying, hey, everybody, let's see which of these companies is the most likely to be successful. They're just putting them out there and hoping that investors will say, I'll take a chance on that one. But that's what it is. It's gambling. Look, I mean, I like gambling, but I like counting cards better, okay? So if I gamble, I count the cards, okay? And that's what we do here. We count the cards on what's going to happen in this situation. And I don't have to memorize a 6-deck shoe. I can just look at the data that's in my system. So traditional VCs and angels, as you know, don't do that well, right? So no offense to any traditional angels and VCs in the room, but on average, they don't even do as well as the S&P 500. And a lot of people do a lot worse. So I think that we've got a real line on things that can be done better. So far, it's going great. We have a number of competitive advantages that others don't have. We get great deal flow. Over 1,000 companies apply every year. We have our unique and proprietary algorithms that we talked about. We're doing this world tour where we're going around to 10 to 20 cities a year. Our acceleration program is really fantastic. It works well. And just if you look at how well the companies have grown since they entered it, it's really impressive. And and I think the most important thing is actually the 50,000 people who are engaged with the platform. I'm pretty much done. So my team is fantastic. Bruce Kaufman is what I call the adult supervision. He's the one with all the SEC licenses. A lot of experience in healthcare venture funding and investing. And Sharad Mishra, who's here, is our clinical expert, but also an MBA who trained at Apollo, has done some startup stuff, and really developed our due diligence process from the ground up. I did 3.5 years of a pathology PhD and started my first startup. It took off like a rocket ship, and I never went back. But I've run a bunch of companies and done a bunch of funding for other companies and invested. and of course, created the MedStartr platform in the first place. So thank you for your time. We would love to have you guys in the fund. It's growing. We'd like to do our next closing by the end of May. So if you're interested, please write down on the forums or come talk to us. Sharad and I are here for another couple hours. Thanks. Any questions? Anybody? Nope. Okay.
This is
That was-
monumental work that
Thanks, Rudy.
you've done.
Thanks.
When you first started, did you have the idea that this is how it's going to go, or did you kind of create as you went along?
I'm a scientist, at heart. I had no idea that I was supposed to be a venture capitalist. So literally, we did that retrospective analysis at the end of 2015. And then I said, okay, well, so we're supposed to be a venture fund. Now what do we do? So we read a bunch of books on the topic. I brought Bruce in, then I brought Sharad in. And then we ran our first, the one that Daniel won, was our first equity crowd challenge where we were sponsoring it so we could develop the crowd metrics model a little more detailed. So it took us another year after that to really sort of get our ducks in a row and then to do the paperwork and things like that. So no, at the beginning we just created a community for ourselves and for others like us. So really, if you look like JP Morgan and like the traditional investment banks, they're investment banks that now do events, right, to get engaged with the community. We actually went the other way up, right, bottom up instead of top down. We started with a community and then eventually figured out, hey, the best way we can help the most companies and also make a sustainable business model is to become venture capitalists. And I gotta say, it's been very gratifying. It's a good question though, thank you. Any other questions? Yes?
I was looking at the list of the companies that you had in there. Did I see One Medical? Was that part of your?
We've done events for One Medical that they've sponsored. So yeah, so these are just the ones that donated or gave us something significant in exchange for our assistants doing whatever they wanted to do.
Okay.
So we partner with them because we help them connect with the community. So we brought Todd Park to Pfizer. We ran a challenge for Allscripts. In San Francisco, we ran an event called Healthcare Revolution for Aetna, GE, and Verizon. Alliance for Better Health is that one that Jacob Rader works for, so we ran 2 contests for them. HP sponsored our mental health contest. Microsoft sponsors a bunch of our stuff. We ran 3 crowd challenges for the American Heart Association. We ran 1 for the American Medical Informatics Association. So I'm just sort of going through some of these things. But there's actually like another 100 companies we've worked with, but these are just the interesting ones.
Right, okay.
Yeah, or the bigger ones that we've done bigger things for. Just because we've been doing this, not the venture fund. The venture fund we just started last year, but we've been doing MedStartr, and before that, Health 2.0 New York, the meetup group that we started, or that we ran for a long time. Yes?
Counting cards can get you thrown out of the casino.
This is true. I'm not very good at it anymore. Honestly, Sharad can attest to this.
And we also did get thrown out of the casino.
Sorry?
We did?
It was a good night, but continue.
Quick question. There is a cap on equity crowdfunding, right? It's 1.05 million or something?
Yeah, so the way the Jobs Act wound up being implemented wasn't exactly what we were hoping for.
Yeah.
So even though you can click the invest button on MedStartr, it's really just a data collection tool. It's not that different from that piece of paper in front of you, okay? But it collects more information and then it sends it to the entrepreneur. They can get into a secure data room, which is typical of most of these crowdfunding sites, except that we're very entrepreneur focused, meaning if Dan doesn't want to let anybody into his data room, he can say no to anybody, right? Versus, I was on one of those sites today, and you could go into the full data room without even signing into the website. That's just crazy.
But he's capped. He's capped at 1.05
I think it's 1.0.
That's if you're doing Reg CF.
It's what?
So it's called Reg CF, Red Crowdfunding.
Right.
I think it's 1 million a year.
It's slightly, they just increased it, I think it's like 1.17 or 1.07.
Yeah, so we don't do that. Okay, we would have to be an SEC accredited crowdfunding portal if we were going to accept people's money and take a percentage of it. So we've chosen to do the simpler thing, which is just collect interest. So they're not firm commitments. Okay, we ask them how firm the commitment is, and of the $119,000, how much of that actually came in? 750. So yeah, I mean it shows it online that helps people get where they want to go. So
Propel X, how do you guys compare against Propel X?
I don't know Propel X. Do you, Shrod?
There's so many of them out there that.
Well, Propel X is really big for life science and medicine out here, and they're doing something very similar where you have your portfolio, your profile up, and then their investors within their network look at you, and they don't necessarily make a bid, but they click on you, and then you can actually go in, and then they can decide how much they want to put in based on your valuation and all that.
So I would say that similar to an Angel MD, they're just doing the finish line. We think it's important to have all of the steps along the way. You know, we think patients are very important to this process. And patients and physicians are probably the two least powerful groups when it comes to deciding which ideas get to market, or at least they used to be, okay? So now, you know, we can get involved. We can get behind an idea, support the idea, and help it get going faster. I think James Madera said it worst when he said, the head of the AMA, that digital health is the new snake oil. Okay, I mean, granted, I think he did that in order to get a lot of attention. Now, they're my client, you know, so, you know, I probably should be nicer. But the idea that physicians didn't have a say in what was coming next, that they had EMRs shoved down their throats that they didn't want, okay, the best way to get involved is to be part of the solution. So this helps that, and it's not just as investors, but also just as, hey, I'd like to try that for my patients. I believe we might be out of time.
Thank you very much.
Thank you.